What is going on, everyone? It is me, TJ Jackson, and we are live to do our third, I believe it's our third session on COVID-19. It is still here, it is still with us, and of course, I have Dr. David who will be joining me to answer your guys' question, to answer my question, and to make sure we are doing all we can to finish through and stay safe during this pandemic. I have a bunch of questions from you guys, so I'm going to get to them for Dr. David. But here he is, the man of the hour, the one and only, the synthetic biologist and bioengineer from
Yes,
MIT, Dr. David Kong. I got that all right, right?
you got it perfect, TJ. So great to see you, brother. So great to
How
see
are
your
you, man?
beautiful smile.
Oh,
Um,
thank you, man. It's been a little while,
it
and thank you
has.
for being patient. I had my first virtual funeral
Ugh,
Zoom for a funeral service that was absolutely beautiful.
hmm.
And before we get started, I just wanted to give a shout out and a big hug and love to the person I lost, the Queen, Miss Ellen Miller. So I love you all, the Miller family. I love you like my family. So my heart is with you guys. But as you know, Dr. David, we had this planned for a couple days, and we need to discuss COVID.
Yeah,
How are we doing overall? That's my first question. Are
yeah,
we? I think I know this answer because I know here in the States we're not doing so well, but
yeah,
just give us a little update. Where are we at?
yeah. So I think, there's bad news, but there's also a lot of good news, right? So it's very much kind of a mixed bag. I would say that right now where we are, we're right before Thanksgiving in the United States, and you know, honestly, the pandemic right now is the worst that it has been the
Yeah.
entire kind of duration.
No, so real quick, because I want to
Yeah.
talk about that. I've seen that we're at the record level of, I guess, positive cases
Yep.
currently.
Yep.
But I think a lot of people will make the argument, well, that's because we're doing a record number of tests.
Yeah.
But to me, one of the big reasonings why we're in a very dangerous time right now is because I also saw we're at the record number for hospitalizations.
Oh yeah.
And
Yes.
that has nothing to do with how many tests there are. That's just people needing assistance.
Yeah.
And
Yeah.
after what, 8 months of being in this pandemic, to know that we are just now at the highest amount of hospitalization should tell everyone that we have to be careful. We've heard about vaccinations coming. Um,
Yep.
of course, a couple, I think Pfizer, Moderna. Did I say
Yep.
that?
Moderna.
Moderna.
Yeah, you're on it, TJ. You
And
got
then
it.
there's
Yeah.
one more. There's one more.
AstraZeneca.
Okay,
AstraZeneca.
so
Yep.
I
Yep.
know they're on their way, but we
Yep.
have to finish strong and be smart.
Yes. Yes.
Am I nailing this? So you're
What do you
smiling.
need me here? What do you need me here for, man? You're the expert, Dr. TJ Jackson, bringing the truth to the people.
I just wanted to make sure I understood where we are at. So if I miss something, please
Yeah.
elaborate on it. And if there's something you want to add, please do so.
Yeah, yeah, for sure. So I think you've got the overall picture, pretty well. I'll give you the exact number actually, or an approximate number. We've got just about 86,000 current active COVID patients in hospitals in the US, which is shattering records. That is the largest number of patients we've had in hospitals this entire time. And just to give you a sense of the scale of the infection right now, when you and I last talked at the end of July, we had about 4 million infections total. Okay, there are 4 million infections total. Just since the start of November, the start of this month, we've had 3.1 million infections just this month,
Wow. So in
right?
3 weeks.
In 3 weeks, we've had as many infections as all the way from January till July and the end of July when you and I last spoke. Okay, so the scale is pretty staggering. And if you look state by state in the United States, right now, 45 out of 50 states are seeing sustained increases. It's going up in 45 states. There's only a handful of states that are managing things pretty well. So if you're in Hawaii, shout outs
Yeah.
to all the brothers and sisters in Hawaii.
Yeah.
You guys are doing a great job. But that's about
Yeah.
it, right? That's about it. Everybody else is struggling with some level of either extremely severe infection or just a very significant community spread, right? Just to give
Mm.
you some more, kind of stats and things to kind of think about. Take, for example, North Dakota, right? Right now, 1 in every 1,000 people in North Dakota has died of COVID. One out of
One
every
out of
1,000.
every.
1,000 people.
Wow.
Yes, it's astonishing, the level of death, right? So
See,
you compare like North Dakota and San Francisco, for example. Both North Dakota and San Francisco, they've got similar populations of people, so like 760 to 800,000 or so people. But the death rate is just very, very different because people are handling things differently in terms of, wearing masks and different types of enforcement on social distancing and so on. So
you would think places like Dakota that aren't so dense in a
yeah,
population sense wouldn't
yes,
have those kind of numbers. What
yes,
is the problem? Is this they're just not wearing masks or not washing? They're
yeah,
not taking it collectively as serious as they
yeah.
should?
Yeah, exactly. I mean, and this is the thing. I have huge empathy for everybody literally on planet Earth right now that's dealing with this pandemic. And, we got a lot of brothers and sisters that either think that COVID-19 is a hoax or they think
Yeah.
that it's not something serious. And, I have a lot of empathy for those folks too, because we have certain leadership that has been
Yeah.
spreading, frankly, a lot of misinformation, right? I mean,
Yeah.
you literally, there are these tragic stories about nurses in South Dakota where patients are literally dying. They're on their deathbeds of COVID-19 and they don't believe they have it. They're like, I don't have COVID-19. This is not real.
Wow.
I'm dying of something else. It's not COVID, right? So we've got a situation where there's just a lot of misinformation out there, and there's a lot of folks that, because of this misinformation, aren't taking things nearly as seriously as they should. And that to me is kind of like just the big tragedy involved. There's
I agree.
so much death that's unnecessary.
And this is why it's important to do this, I think, at this time, because I think a lot of us are suffering from this
Yes.
coronavirus fatigue, or I
Oh,
should say the
totally.
pandemic fatigue.
Yeah. Yeah.
And we are in this stretch where we have to buckle down.
Yes.
And
Yes.
I will say this, because I'm not a big fan of media at all. So I know a
Yeah.
lot of people who don't believe in the virus or don't believe the severity of the virus have a lot of issues with the media, as do I. But
Totally.
I'm also
Yeah.
in a position where I get to talk to a lot of people, and I know several people who have this virus,
Yeah.
who are healthy people who are struggling with it.
Yeah.
And the theme is the same. You don't want this,
Yeah.
and I just find it hard, and I think we've said this before. I don't understand why we just can't just buckle down, wear
Yeah.
masks, and do what we're supposed to do,
Yeah.
and not make it such a it's a not truth, it's truth. Just do what's needed. And I think I don't know if I've said this, but I think that's a big issue we have here in the States. There's a lot of pride in impeding on our rights or on our freedom, where
Yeah.
other countries don't have that. They can collectively get together, and
Yeah.
I think that's why they do better. So
Yeah.
I'm making my little plea to everyone out there who may not believe in it or may not think it's a real deal. It is real, and I know many people who are struggling with it, and you don't want it. So please just
Yeah.
stay on it, and please listen with an open mind.
Yeah.
Um, Saying that, this is a Q&A session, so anyone who's watching live, feel free to ask questions. I have a bunch of questions that I haven't even seen yet, that from the story I posted last night. But are you ready, Dr. David, to start getting into some of these
Let's
questions and
do it.
answers?
Let's dig in. Let's do
All
it.
right. So the first one is from 469 Jitsuke. She asked, still do not know if I will use the vaccination. Do you have any advice?
Yeah. Yeah. That's a really great question. So right now, as you were saying earlier, there's 3 vaccines just in the past few weeks that have released a number of their amount of their clinical trial data that so far looks very, very promising. Okay, so we've got, as you mentioned, the Pfizer vaccine, the Moderna vaccine, and then this AstraZeneca vaccine. And so the Pfizer vaccine and the Moderna vaccine are shown to be very, very effective. So greater than 90%, some 95% of people that so far have been vaccinated, it looks like that vaccine provides protection against both either infection or severe illness, right? So
Mm.
all 3 vaccines have been shown to be effective against severe illness. So how these clinical trials work is in all 3 of the cases, there's tens of thousands of people involved. I think it's like, 40 plus thousand people involved in the Moderna trial, and similarly 30,000 plus people involved in the Pfizer trial. And so they basically take a bunch of people that are given a placebo. They're given something that's not the vaccine, and then a bunch of people that are given the vaccine. And then over time, they track the infections and they see who gets sick and who doesn't get sick, right? And basically, what they found for all three of these vaccines, and they all work in slightly different ways technically, but there's a couple of really key findings. One, it looks like severe illness is basically completely prevented. So there were I think in the case of, for example, both the Pfizer and the Moderna vaccines, there's like 10, 11 people that got very severe illness. Nobody that had the vaccine got severe illness. So that's really, really good, right? Just the fact that it prevents severe illness is very good. And then the other aspect, of course, is just if you look at infection overall, again, you're seeing very, very significant protection. So far, the data is looking very good. Now, the one caveat that I would give is the trials are still ongoing. So they released some of this initial data to get what's called an emergency use authorization, so that in the United States, the FDA can basically give an approval so that some of these vaccines can be administered earlier on without having to finish the entire trial. So giving it to, for example, healthcare workers, like the real at-risk community folks that need to get protected right now. So those emergency use authorizations are in process right now. So, but we still do want to wait, right? There are some rare examples where there could be some side effects that occur later on that it's only been a couple of months basically since the second doses of the vaccines have been administered. So we still need to let it play out a little bit over time. But man, is it promising to have 3 vaccines that look like they could be really, really effective, right? So,
Yeah.
and oh, go ahead.
Yeah, a quick question. So
Yeah.
when do you take a vaccination? I know from what I understand, the first round of vaccinations are going to go to essential workers and those who are more at risk.
That's right.
But the minute you can, do you have enough confidence? Because this is something I've seen a lot of people ask.
Yeah.
Should we have confidence in the quote unquote system to protect us and make sure the vaccination won't have other, harmful effects? So my question is to you. When would you feel comfortable, in your opinion, taking the vaccination?
Yeah. So for me personally, I'm waiting for these clinical trials to complete. I'm waiting for the full trial to complete. I'm waiting for several months after these, because now it's been hundreds of thousands of people actually around the world have gotten vaccinated, right? They're going through a variety of these clinical trials. There's, I think, 150 or so vaccine candidates all around the world that are being tested in various stages right now. So we are going to know so much more in December, January, just in a couple of months, we're going to know a lot more. And so for me, that's what I'm waiting for. I'm waiting to see early 2021 on how this data plays out. If it still continues to be that there's no significant side effects, and you've got hundreds of thousands of people that are being tested now, that is a lot of people. So statistically, the likelihood, if there is something really bad that's going to occur, we're going to see that in the course of a couple months. So if things continue as they are, I will 100% be so excited to take the vaccine, because again,
I don't know if this is something I asked last time, but do we know if this is this gonna be a one-time type of vaccination, or is this an annual vaccination?
So this is one of the big questions that is still unknown, is how long does the immunity last for, right? So we've got some data based on when you get sick, just based on reinfection, right? It looks like there was actually just a study that came out this past week from the University of Oxford that was looking at around 13,000 hospital workers in the UK, and basically it looks like you're getting at least like 6 months of protection after if you get sick from the virus without a vaccine. It's about 6 months before the risk of reinfection starts to increase overall, which is pretty good. That's promising, right? So it means that like you're it's not like 2 months later you get sick and then you can get reinfected again. Now, in some rare cases that may happen, but we're seeing kind of that amount of time. This is for natural infection. For the vaccine, that's one of the big questions. How often are we going to need to kind of retake it? Basically, how long does that immunity last for? And so that's another kind of factor that's we're gonna be studying and learning more about as these clinical trials go on. But so far though, it's looking again, the protection is looking very good. And typically certainly the Pfizer and the Moderna and the AstraZeneca one, they're typically 2 doses. So you get a first shot, and then like a month later you get a second shot, and then after that you get protection for who knows how long, right? We've been about 2 months or so, 2 to 3 months after the original kind of clinical trial period. So again, we're going to know so much more in a couple months.
Okay, great. Another question that, and I got to get to the ones on the stories, but Gina, I know this is Gina. She asked, is there any vegetables that we should eat if we have coronavirus? So
Oh man,
basically, I'm going to rephrase this question and add to
yeah.
it. Is there anything that, if we do have coronavirus or we think we have it, is there something you would suggest us to eat or consume that can maybe help it not
Yeah.
blow up into a worst case?
Oh man, that's a really, really awesome question too. So I want to be careful here because while I am a doctor, I am not a coronavirus medical doctor. So I don't want to give your followers any incorrect advice. But I
Thank you
will,
for that, by the way.
but I will say in general, right? Things, common sense things that you can do to keep yourself healthy and fit are really, really important, right? So whether you have coronavirus or not, like I, for example, take a multivitamin every day. I'm making sure I'm getting a lot of vitamin C, a lot of vitamin D, a lot of zinc. These are some good vitamins that are just good for your immune system and you're good for your immune health. So getting a lot of sleep, drinking a lot of water, these are all kind of a lot of common sense things. They're just very, very helpful. So eating your veggies, all of eating fruits and veggies, having a really good diet, getting good sleep, good exercise. These are all just very important things for general health that are going to translate well for COVID, right? So I think, a really critical point though is that, when we started this pandemic back in January, February, there were zero treatments, right? So like, if you got sick, you literally were only relying on your own body to help get you through it. That was that your only army was your own body, right? Now, thank goodness, right? All these months later, there's a cavalry, right? If you get sick now, there's a handful of treatments that are looking really good, and there's two therapeutics in particular that are called monoclonal antibody treatments. So the way that the vaccine works, you're basically stimulating your immune system to create these proteins called antibodies, which are very specific to the SARS-CoV-2 virus. So they'll go and grab and attack that virus. So you can either get your body to make it, which is what happens with a vaccine, or you can actually synthetically just take some of these antibodies, usually via like an IV or a drip, and you can actually have those synthetic antibodies given to you as a
Mm.
treatment. And so similar to the vaccines, other amazing news is there are now two antibody treatments that have been approved for emergency use. So Eli Lilly's created one, and then there's another one called this Regeneron cocktail. So these are two antibody treatments. And
Mm.
famously, President Trump, when he got sick, was able to get the Regeneron cocktail, which
Yeah.
if you get it early in your sickness, and Trump early on, it did not look good for him actually. So he is extraordinarily lucky that he's the
We,
president of the United States and got access to that
Yeah,
cocktail.
and I think a lot of people assume that because he had a whole array of doctors there
Oh
to
yeah,
at his beck and call, which
correct.
95% of 99% of Americans
99.999% of us do not
don't
have
have
that.
that luxury.
Correct.
But when you say it didn't look good for him, how are you basing that off of? What was it, a certain level or a certain measurement that, or what was it?
Well, just the fact that he needed this treatment at all. So
Okay.
it's an experimental cocktail, right? And when Trump received it back in October, it was still not FDA approved, so the clinical trials were still ongoing. So the fact that the doctors thought it was even necessary to give him this emergency cocktail of drugs is a sign, and he also had to be hospitalized. So there are a bunch of indications that he was having like he was not having an asymptomatic or mild case, right? But
Mm.
the good news is that it worked, right? And that this treatment, especially when administered early on during the course of an infection, has statistically shown that it can really reduce the severity of the disease. So that's the great news. Now, and going back to your point, TJ, about we got to just get through this period. The vaccine, the therapeutics, we don't have these yet at CVS or in our local hospital, right? The therapeutics, they're amazing, but there's only like tens of thousands of doses of them right now. There's a
Mm.
whole logistics and manufacturing and distribution question, right? How do we get hundreds of millions of doses of these things? How do we store them? How do we ship them? How do we get them around to the communities that really need them? That right now is one of the biggest problems. It's a logistics problem that we're facing for both the therapies and the vaccines.
Let me ask you a quick question on the vaccinations. Do you think, or I should say this, do you know if they could be forced, if they could be required to do basic things, whether it's go to school, and do you expect that to happen?
So one thing we're already seeing right now is that certain airlines are very seriously exploring the idea of, hey, if you want to get on my airplane and go to Australia, like Qantas was something I just saw in the news yesterday. If you want to get on an airplane and come to Australia and fly Qantas, then you're going to need to show proof of vaccination to get on the airplane, right?
Wow.
The answer to your question is it's going to depend a lot, right? I
Mm.
think in the United States, the likelihood that that any level of government, that the federal government or a state government is going to require anybody to get vaccinated at a government level is probably pretty low. I mean, people think about people right now just with mandates around masks. Forget
Yeah,
like
it's true.
getting a needle in your arm, right? Now, that said, there are going to be certain environments where they might require that, right? There might be certain workplaces that say, you know what, in order for you to work here, we require you to get vaccinated. And this
Yeah.
is going to be true of things like hospitals or long care so for example, like nursing homes and those types of care settings for the elderly, that's another high priority place where folks are getting vaccinated. So depending on the institution, a certain hospital or a certain place might say, hey, in order for you to work here, we're going to require you to be vaccinated. And so you're going to have that choice. You can decide, hey, I don't want to work at that hospital and not get vaccinated, which is your choice. But I don't think we're going to see that at the state or federal level. But like I said, though, you might see certain things where like certain companies might say like, hey, if you want to come to my concert venue, you're going to
Yeah.
have to show proof of vaccination, right? And
Yeah.
I think those are things that we might start seeing more and more of in 2021 around the world.
Okay, a question from Toria. Do we know if we can ever recover from it? Or will it just go dormant and then reactivate later when we least expect it? Is
Yeah.
this something that we can recover from once we have it?
Yeah, so the answer is definitely yes, right? We see all kinds of examples of people that have very mild cases or what are called asymptomatic cases. So you're sick, you actually have a COVID infection, but you don't even have any symptoms, right? So it's very possible, of course, to get a mild case, and that happens with significant frequency. Now, another caveat here, though, is even for people that are asymptomatic, that never get symptoms, when we actually look at and do heart scans or CAT scans and really do kind of detailed look into the body, there is often evidence of opacities or damage to the lungs or myocardial damage, so damage to the heart. So some things where you may feel fine, but actually there is some evidence of damage. And so we've
Mm.
seen this play out already with some professional athletes that have gotten COVID. They seem like they're fine, then they start trying to play again, and it turns out that their heart is not what it used to be, or their lungs are not what they used to be. So going back to your earlier point, you do not want this, right? You
Mm.
just do not want to get this thing. And this is, I think, one of the really, I think one of the saddest parts about COVID is that there are these people that are what are called quote unquote long haulers. They get sick and they recover meaning they no longer have an active infection, so they're no longer contagious and they're not shedding virus anymore, but they are suffering just months and months later. They still have chronic fatigue, they've got brain fog, they've still lost their smell, their sense of smell. And so there's there's something like 10% of people actually, there's a variety of studies that are looking at this, that even after they've recovered still have symptoms afterwards, right? 10% is a huge number, like 1 in 10 people. So
Mm.
if you get sick, the likelihood that you have long-term effects, it's a pretty significant number of folks that have that situation. And so yeah, this COVID is just not something to play with for sure.
But we
Go ahead.
don't know if you get sick and you have if you're in that 10% that has the long-term effects.
Yeah.
We don't know if in 5 years, if it will go, or 2 years, or 5 years, or 10 years, it will go away. Or do we know that?
So the virus in those cases has your immune system nominally has dealt with the virus, and so you're no longer contagious. You're not shedding the virus anymore. It's just the symptoms are still there. So in other words, the virus, because it affects so many systems in the body, it affects your brains, all of these different organs, your heart, your lungs, etc. Even after you're no longer contagious, the after effects on your body can still stay, right? So the
Yeah.
neurological damage can still stay, and this is one of the big active areas of study. At Mount Sinai in New York, there's a whole institute that's set up just to study these quote unquote long haulers. And that's a big active area of research, is how long do these symptoms last? Even after you're no longer infectious and contagious, how long does it last? And what are the reasons why it could last that long? Those are still things that we're unraveling right now, and that's actively being studied in the research community.
Nice. Okay. This is a question from Invincible Mafia. She says, "Do you think COVID has an ending to it?" And by the way, she loves you, David.
Aw, I love you too. Was it Infinite Mafia?
Yes.
What a username. I love that. Um,
Do you think COVID has an ending to it?
well, it depends what you mean by ending, right? All movies have an ending. It just depends on, is it a happy ending? Is it suspense? Et cetera. COVID, unfortunately, given the way that it has played out and just how everywhere it is, particularly in the United States, it's likely to be a type of virus that just stays in the population and circulates at some level, right? But what's likely to happen, though, is as we continue this unprecedented rollout of these therapeutics and the vaccination and so on, because this is the other really great part about vaccination, right? Like once you have enough people that actually have immunity, and so that the virus, because remember, the virus doesn't survive on its own. The virus needs humans to spread it, right? The virus only lives inside of humans and in some case some other animals, but it needs us to spread it. So if I have my vaccination and you are immune from it as well, TJ, then the virus just has nowhere to go. So the more people that end up developing immunity, just like we've had this exponential increase in infection, we will also see an exponential decrease in infection. So once those first waves of vaccination start getting out there and people start becoming immune, we're going to see the impact of COVID start decreasing very significantly. And so in places that are going to have access to the vaccine, places like the United States, Europe, places that are more moderately wealthy, like the AstraZeneca vaccine, it's something like a $3 to $4 vaccine. So it's pretty inexpensive and it's obviously well worth the cost. So we're going to see, I think, in 2021, certainly by this time, a year from now, we're going to be in so much better shape, right? So COVID is going to be, dramatically reduced, I think, in 2021, but it'll still be circulating, right? And certainly for parts of the world that don't have the same infrastructure as the United States or Europe, for example, we'll still be dealing with infection, I think, for a little while.
Okay, another question from Kit Kat Michael. He says, my wife has lung damage from virus. Will vaccine keep her safe? And what about antibodies?
I'm assuming when you say lung damage from the virus, if they're talking about from SARS-CoV-2 or from COVID-19,
From COVID.
yeah, from COVID. So, again, I think if you've already been infected, right, the likelihood of reinfection over the course of at least the first number of months after the infection is very, very low. That's what the studies are showing, and which is very, very good, right? We're not seeing, COVID's been around since like January, and look at the United States where there's just, millions of infections. We're not seeing this giant wave of reinfections in the news, right? There aren't all these news stories of like, oh, I got COVID twice. Now, of course, there's many examples of it, and I was looking at some of the statistics before the call. There are examples of reinfection in a variety of countries, but it's like 50 people, 30 people. It's not, huge numbers. So in other words, after you get an infection, and particularly if it's a severe infection, so if your wife actually had, lung damage, and it sounds like they might have had a very severe COVID infection, then your immune system is basically better trained. And so the likelihood that you're going to get another severe infection is low. So that's another thing that was born from this University of Oxford study that came out just earlier this week. So the people that do have more severe COVID, if they get reinfected at all the second time, sometimes it may even be asymptomatic, right? They have an infection, but they don't even have symptoms, right? The danger there, though, is even though you may not have severe sickness, you might still be able to infect other people. So still wear your mask, still keep the social distancing going, but the likelihood that you're going to get really sick twice is very low.
This is a question. The question is, how much water do you drink every day? But that's not the question I want to ask you. It just spurred a question in my head.
Yeah.
Does drinking water or does flushing your system out, does that have any benefits to avoiding any type of, long-term situation or a less severe, does it contribute to a less severe maybe bout with COVID if you get it?
Right. So I'm going to put on my not a COVID medical doctor hat again,
Okay,
and just caveat though. But drinking water in general is just very, very good for health, like broad spectrum health, immune health, etc. I know that I do not drink enough water. Actually, where's my water bottle? I got my water bottle right here though. So I should be drinking more of this.
That's
but
a cool bottle. Is that
yeah.
keep it cold or something?
This is just a normal water bottle. I actually got this in Yosemite, so this is a neat little souvenir that I got. But yeah, definitely hydration is very, very important. I forget the exact kind of amount of water that's recommended, but
water is just a good thing to continue.
Water is life. Water, to quote LaDonna Brave-Bull and the friends at Standing Rock, water is life. So stay hydrated.
The question that last time we spoke, we talked about children and COVID, and
Yeah.
I believe At least then it was that COVID doesn't seem to affect kids as much. Is that still the case? And are kids just somehow just naturally more resilient, or what's the
Yeah.
situation with COVID in children at this point?
Yeah, great question. So in general, kids can definitely get COVID, and kids can definitely be vectors of contagion. So they can definitely infect others. But as we've seen overall, children still have it is quite well studied that children do get less severe cases of COVID. So the likelihood of severe COVID or death from COVID to children is very, very low. So that's very promising. But they can
Is there a reason?
it's a really so this is still being teased out and tried and understood. So there's a couple of hypotheses for why this might be. So COVID-19 is again the respiratory illness caused by SARS-CoV-2. That's the technical name of the virus, which is a coronavirus. There's five other or so coronaviruses, and three of those coronaviruses cause the common cold, right? So much like we were talking about reinfection earlier, one of the hypotheses is that if you've recently gotten infected with a cold coronavirus, then you may have a little bit of latent immunity so that if you get infected with another coronavirus, you may have a little bit less susceptibility. So, kids are, getting sick, especially little kids, they're around other kids. There's a lot of cold viruses going around, right? As I think as any parents know. I don't have any kids, so I can't speak about this from first-person experience, but TJ, I know you've got a number of beautiful children, and I know they get sick. Kids are
Yeah.
always bringing the sickness home. So that's one thought, is that exposure to previous coronaviruses could be one of the reasons why. Another big reason, of course, is just immune health, right? Kids compared to the elderly just have a stronger immune systems than older folks do, who are more at risk for disease. And those kind of cover the two spectrums of immunity, right? There's your innate immune system, just kind of like how healthy are you generally, and then there's your adapted immune system, like how specifically good are you at fighting coronavirus, right? So if you've gotten one of these other colds, maybe that's helping your system, and that may be part of why kids are a little bit less prone to more severe illness. But I think that's a really important question that we're still teasing out and understanding better.
Okay, another question, and this is a question pretty much from me because I don't usually like to do flu shots.
Yeah, no, understandable. Yep.
I actually haven't done the flu shot. I think I've done once in my life, probably like 5, 6 years ago. And I
Yeah.
always ask the doctor, what would you do? And they always say I would do it. So
Yeah.
I almost always do it, but I end up not doing it. But anyway, this year, I asked my doctor, what would you do? And he said, I would definitely do it,
Yeah.
especially with COVID.
Yeah.
I just wouldn't want to have a flu and COVID in the same sentence. So
Yeah.
he convinced me to do it. I took my flu shot. Does that help possibly reduce the effects of COVID, or is there any benefit to doing a flu shot in relation to COVID?
So there are two different viruses. So your flu shot will not protect you from COVID. However, it's still important to get your flu shot. And the reason is this, right? And this kind of zooms out back into like where we are in the United States, and in a way, just how desperate things are. You've got states right now where there are literally no hospital beds available. Okay, there are literally no hospital beds available. There are parts of our country where we are running out of healthcare workers. So we may even have beds, but they're not healthcare workers to even help to help treat patients anymore. In North Dakota, which we've been talking a little bit about, the governor recently passed kind of a law or a decree basically saying that even if you're sick with COVID and you're a healthcare worker, it's still okay for you to work, right? They have that few healthcare workers that they're still asking you to go to work if you're sick. Okay.
Wow.
So we are in a situation right now where, if you look at the earlier days of the outbreak, when we had, when it was really bad in just, kind of New York or New Jersey, tri-state area in the Northeast, well, what was happening? You could have nurses and medical professionals from all other parts of the world traveling to the Northeast to go help in New York. And that's exactly what happened. Our healthcare heroes, and they are here. When this is all done, TJ, I hope that the musicians write songs, we build some monuments. I mean, we do everything that we can to really acknowledge just the heroism of the scientific community for working at unprecedented speeds to create all these vaccines and therapies, to all our healthcare heroes that are doing all that work in the front line. I mean, it is heroic what they're doing.
And you know
right?
what I want to say? I want to add to that because you're
Yeah.
100% right. And I think about it every now and then, but always forget to mention it. These are individuals who show up to work to try to help people
Yes.
who are making decisions to not really care for themselves and
Yes.
finding themselves going to hospitals because they're, you know, and it's just like you said, they're heroes because they
Yes.
are stuck there,
Yeah.
putting their own health on the
Yes.
line to help
For
people
us.
who didn't want to do anything or didn't
Yes.
want to. And I commend them, you know,
Yeah.
and I'm proud that and thankful that you brought that up. So
Yeah.
thank you.
Yeah. So TJ, I think, going back to the question about the flu shot, the whole point here is that our hospital system in the United States is like bursting at the seams. It is on the verge of collapse in different parts of the country. Like I'm seeing some of the comments that are coming here about tents being set up around hospitals because they don't have enough morgue space for dead bodies. I mean, El Paso is like, I mean,
Mm-hmm.
there are parts of the country right now, and the virus is everywhere. That's my earlier point. 45 states, the rate of infection is increasing, right? So now it's not like earlier in the pandemic where it was just a couple of hotspots. It is everywhere. It is literally everywhere right now. And so because of that, because of the strain on our hospital system that COVID has placed, if you do have the flu or if you do have any other disease, where's your bed, right? Where are you going to go? Like we don't have enough hospital workers. We don't have enough beds to treat severe
Mm-hmm.
COVID. So if you do get severe flu or pneumonia, where are you going? Where are we going to put you, right? So being able to get a flu shot and ensuring that you're protecting yourself. And again, it's protecting yourself, but it's also making sure that you don't infect other people, right? So that's the other, I think, kind of just big message. I think we still, we've said it every single one of our lives, and we got to say it again. We are a big global family. We're going to get through this together, and we got to care for one another. We have to think outside of just like our own individuality and think about our community, think about our neighborhoods, think about all the people that we love and care about, and even people we don't even know, right? The
Mm-hmm.
elderly people down the street. And how do we protect them, right? We protect them by not getting sick ourselves, right? This is not like heart disease, right? Where if I get sick, it's my own individual choice. I can eat a terrible, I can eat Big Macs every day and then, get heart disease and have a big problem. That's fine. That's my own choice. Heart disease is not infectious, right? I can't infect you with my heart disease, right? But I can infect you with COVID-19. I can infect you with the flu, right? So it's incumbent upon us to just take it seriously. And this is what we're saying, and just to emphasize what you're saying, TJ, it's not forever. We just got to
Mm-hmm.
get through these bunch of months.
Mm-hmm.
Like, this Thanksgiving and the holidays, just stay with your little pod, don't do the big gatherings. Do 3 Thanksgivings next year. Do double Christmas, you know what I mean?
Mm-hmm.
Just like we're gonna live it up at the end of 2021, and we're gonna have, I mean, I think like your concerts at the end of 2021, TJ, are gonna be so lit. Like they're gonna be,
Yeah.
seriously, right? Think
Hey,
about it. Like once we get there, it's gonna be amazing, right?
yeah, we just got
So
to get through
we
this
just got to
time.
get there. We just got to get there. There's
Yeah.
the light is at the end of the tunnel. So all of this death, 258,000 deaths in the United States, like 1,500 to 2,000 people dying per day right now, and that number is going to get bigger. Like, what are we doing here? All of these people do not have to die right now, right? We just
Mm-hmm.
all got to buckle down, take this serious. It's not forever. It's just a few months. It's a few months, and then we got to get our Congress to pass some legislation so that we can all get paid to stay at home. This is what every other civilized country that's doing this is
Yeah.
doing. Canada, Europe, all the countries throughout Europe, they're getting paid to stay at home, right? We got what, a $1,200 check, like at some point? Like it's
Yeah.
ridiculous,
For
right?
the whole, that's, yeah.
So we should be getting paid monthly to stay at home, sit on our asses, be with our family, hang out via Zoom, and just let this period pass. The therapies are
Yeah.
coming, the vaccines are coming, it's all coming, We just got to get through this period.
Um, Another question I had, I lost it for a second, but where did it go? Okay, well, I just wanted to make a point. I saw someone also say something about how they got it and it wasn't so bad. It was just like a cold.
Yeah,
And I just want to make the clarification, and you correct me if I'm wrong.
yeah,
Just because you may have gotten it and it was just like the cold for you, for many others, it's not
yes.
just like the cold.
Oh, yeah,
And I think sometimes, and it's not, I can't blame the person who shares that because they're being authentic and being true to their story about
yep,
COVID.
yep,
But the problem is sometimes when we read that, we think it's just like the cold.
yeah,
Our minds aren't trained to look past a statement like that. So I think that's what's been contributing to
yeah,
all of this kind of
yeah,
misinformation, which is so unfortunate. But
yeah,
it is what it is. But like I said, and I started earlier on this video stream, said I know several people who have it, And
Yeah.
I know some people who've lost a family member because of it.
Yeah.
And if I could convince anyone, all of you, to just stay strong and finish this quarantine period out, it looks like help is on its way.
Yeah.
Please do so. Do what you have to do. And like you said, Dr. David, if you have to take some time away and minimize these holiday seasons coming up, do so.
Yeah.
It could be the difference between life and death, or even just having issues for the rest of your life. I think that's another
Exactly.
problem. We
Exactly.
always think just deaths. We always
Yeah.
think that
Exactly.
we
Exactly.
quantify how bad a virus is simply off death, when we don't really talk about damage to lungs or
Ugh.
any other issues that could develop from a virus. So we have to be a bit more smarter and not just read headlines or not just see, we have to really dig in. And when you dig in, you're going to want to be safer. So please be smart, everyone.
Preach, TJ. You're on fire.
Uh, Wait, this is our third time doing it. So I think I've learned a lot from you, Dr.
Uh,
David. So it's
but
all good.
the one other thing I would add though about the person that just had the cold, remember, right? It's not about just you, right? It's not about just you. If you've got a cold and that's fine, who are you infecting potentially, right? Who are you, the housemates that you're living with, the family members that you're living with? If you're not taking mask wearing seriously, if you're still going out, if you're still got a little bit, you just had COVID and it's just a little cold, but you still went to that party and you didn't wear a mask, right? This is one of the saddest things, right? There's all of these stories now about these so-called super spreader events, right? Where a bunch of family members, they get together, they go to a wedding or whatever. 55 people. There's a particularly well-studied one, a case in Maine. I don't have the numbers right in front of me, so I'm gonna just kind of paraphrase a little bit. There's something like 55 people got infected at a wedding, right? And then they went back to their communities, and 7 people ended up dying, okay, because of that original wedding. That had nothing to do with the wedding, right? They had nothing to do with. They didn't even know those people, but because of that chain of infection from that first cluster, that led to all of these other people getting sick, and then that led to people you didn't even know dying, right? So I think that's the other thing we really got to take to heart. It's not about you. Even if you're like an asymptomatic person, or you just got a common cold, or what your symptoms weren't that bad, who might you be infecting, right? Who are all of those other people that might be suffering because you're irresponsible, because you didn't take it seriously? So I think that's the other
Yeah.
big message we all got to think about.
This is a question from Michael Jackson. I love how they spelled Michael and Jackson. I love it. Mykol. I had never seen that, so I love
Cool.
that. But anyway, how affects the virus people with cancer? And I'm going to add to this question by basically saying, from my understanding, and correct me if I'm wrong, those with some maybe pre-situations,
Yeah.
predispositions, is that the proper term?
Pre-existing conditions is the insurance
Thank you.
term, but yeah.
Pre-existing conditions are more at risk. Is there any pre-existing conditions that we've learned of, being 8 months into this, 9 months into this virus, that are more dangerous than the
Yeah.
others?
Yeah. Yeah. So cancer, anything that affects your immune system, those can lead to some more severe cases. So certainly, if your body is already trying to battle something like cancer, obviously, any new disease that you get is gonna really stress your system and gonna be very, very difficult for you. So that is why we are seeing higher mortality rates for folks that do have cancer. Diabetes and obesity is another big one. So there's a lot of aspects of COVID that are connected to inflammatory response, and also an over kind of autoimmune disorder in a way. So, but we are seeing, for example, obesity, diabetes. Those are a couple of other conditions that tend to have been shown to be correlated with more severe COVID cases. So I do think, though, in general, if you are immune compromised, for example, like my mom has got Parkinson's disease, so. I'm out here. I'm actually out here in California now, TJ. I'm out in Oakland with my family, and
Oh, wow.
but I took a
Well,
lot
I
of
know you're up
precautions.
north at a state park, which looked
Yeah.
amazing.
Yes, I
But I
was.
didn't know
Yeah.
you stayed out. That's
Yeah. Well,
cool.
and this may be a useful story for some of your followers too. Um, I made the decision to travel from Massachusetts to the West Coast to go see my mom and my sister. My mom, again, she's got Parkinson's, and I hadn't seen her in a year, but I really took a huge number of precautions very, very seriously to get out here, right? So about a month ago, I came out here, I flew out here, I got tested multiple times before I left Boston and was also in isolation, quarantine, just making sure I wasn't in contact with others. So I was very confident that I didn't have COVID-19 getting onto the airplane. Once I got onto the airplane, flew out to the West Coast, and then I quarantined again. I landed, I got into an Airbnb and I quarantined for a couple weeks. I got multiple COVID tests while I was in isolation here in Oakland. And then after going through that entire process, then I finally, was able to hang out with my mom without a mask on inside, right? So I was still seeing my mom, here and there, but I was always outside and always with masks on, right? So that's, again, going back to what we know now about transmission, it's really the places that you get COVID-19 are really when you're inside and when you're not wearing masks. That's like the biggest, most common way to get an infection. And so, but I went through those steps to really ensure that, I isolated myself for those 2 weeks, made sure that I was literally not seeing any other human being, got myself multiple COVID tests, and ensured that I felt very confident I didn't have it before I ultimately, saw my mom. So just to
Question
share
for
that
you.
story.
Thank you for sharing that, by the
Yeah.
way, because it prompted some more questions for me.
Yeah, please.
One is when you are inside,
Yes.
I'm in a room right now.
Hmm.
Is just having the window open for fresh air, does that help lessen the chances if someone were to have COVID in this room of me getting it?
Yes, yes, definitely. So this is one of the biggest kind of areas, and there's now been a whole bunch of studies just looking at air filtration or air circulation, right? So there was this very kind of notorious example of this study early on in China, where basically there was a restaurant where where it was a closed box essentially with no open windows and there's no ventilation, and there was an air conditioner that was just basically like a giant fan circulating air in the room, but it was the same air, okay? And so there was one sick person that went in there, and then over the course of dinner, they infected like 50 other people in the room, okay? And
Mm,
the reason was because you're eating dinner, you're not wearing a mask, so everybody's just kind of like talking, and more viruses going out from the sick person, and everybody, because they're breathing in and circulating the same air, you were able to spread that infection, to all of these other people sitting in dinner all around you, okay? You contrast that with an airplane, actually. An airplane, once you're actually inside an airplane, airplanes are actually pretty safe because they're constantly recirculating that volume of air inside there. Okay, and that's also why outdoors is great. Outdoors is basically like infinite air. I mean, you literally have
mm,
infinite air all around you. So if I cough, that virus getting kind of immediately diluted, and that's part of why outdoors is so safe. So if you open up that window, anything you can do to bring fresh air into your house or into your space, super, super important. Anytime you're in some type of a
no,
situation where, even if you're concerned at all about any kind of exposure, open up all your windows. So I'll give you another example. Like, for example, in my house, back in Boston, we had like a guy come in to like try to fix the heater, for example, right? So when that person came in, I wore a mask, that person wore a mask, opened up all the windows, right? I kind of let that person in just like very briefly, and then showed them where the work needed to get done, and then I just went to a whole nother part of the house, opened up all the windows in the house, and just let that air kind of flow, right? And doing that combined with wearing masks, that helps to reduce the risk. Now, the risk
right,
isn't zero, but you've
right.
brought the risk down really, really significantly by wearing that mask inside, and then also opening up your windows and getting lots of good air circulation in there.
It's great. Another question from Ria Herrera is, can I get COVID-19 from my pets or other animals?
Oh, wow. So this is a stellar question, in part because this is how we humans got COVID-19 in the first place, right? COVID-19 started, or SARS-CoV-2, that the virus started, if you kind of sequence the genome of the virus, it started in bats. And it may have even hopped between bats to another type of an organism before it came to humans. And so it's a process called zoonosis. They're called zoonotic viruses. They're viruses that jump between different animal species. And so, unfortunately, we've seen SARS-CoV-2, this particular coronavirus, we've seen it infect different types of animals. So you've seen, yeah, I see somebody talking about cats. Cats can get COVID-19. Right now, there's this pretty famous case of minks right now that are in, I think, Denmark. There's like tens of thousands of minks that have been have been killed because they've been worried about infection there. So it can definitely spread from different animals. Now, what we don't know quite well yet, and I think is the probability is very low, is, for example, if your cat got it, could your cat give it to you? I don't think we've seen very strong cases or evidence of that. Okay, so far it seems at least with the current strain of SARS-CoV-2 that's circulating around, we haven't seen a lot of examples of people getting infected by pets. Like that's not something I've really seen. So it's
So
theoretically possible, but I don't think that's something we have to be too worried about.
now I have a lot of pet lovers in my
Oh, I
fandom.
know,
So
I
so
know.
I'm going to ask if
Yeah.
how do we know if our pet has COVID, or is there, and if they do, is there something we are supposed to do about it?
That is such a great question. I'm gonna have to look into that for you, TJ. I think so. You basically though you can test your cat the same way you test a human. It's the same type of a situation, right? The virus works the same way. It's looking for that ACE2 receptor. It's looking for that same receptor inside a human, just the same way it's looking for it inside your cat. So you nominally, my guess is actually, I'm sure there are COVID tests for pets like that. That's something that is out there.
Wow.
Yeah, I mean, certainly, excuse me, certainly in the examples of the animals that we know have gotten infected, they've gotten that PCR test, so we know that you can get that test. Whether it's commercially available or not, I know less about, but maybe I can look into that and send you a note about that.
No, I appreciate. I'm just looking at this comment. I have a dog. Can my dog get the virus? What? So that's a good question. I don't know if you mentioned dogs. Where are we with dogs? I know cats. You said. Do
Yeah,
we know
cats
about
I've heard
dogs
about.
yet?
Dogs, a good question. I'll look into that. I'll look into that whether or
Okay.
not dogs have gotten it. And if they have, it's a very, again, it's the I have not heard of a single case of a human getting it from a pet. Okay, so just to put that out there, there's, I'm looking at my number of infections in the United States. I mean, what, there's 12.4 million infections that are counted in the United States. The actual number of infected is probably some larger number multiplied by 12.4. But I've not heard of a single case of a person getting infected from a pet. So I think the
Yeah.
incidence of that occurring is very, very low.
Georgina asked, does it depend on blood group how heavy this
Ah,
illness runs? So I
great.
guess in
Yeah,
England they probably refer as blood group, but here we
blood
refer
type.
as blood type.
Yeah, yeah. So
So
that's a really interesting question. There have been some studies that have shown that I think it's I want to be sure to get the blood type right. I think it's type O, but I can again look at this up later. But there are certain blood types where there has been a correlation with more severe illness. So but I want to be careful here. Correlation is not causation. So it's sort of like you look at a whole bunch of people that are sick, you look and see what blood types they all have, and just because somebody that has a higher type O, if they are a certain blood type, if they're more likely for they have a more there are more percentage of those that have severe illness, doesn't necessarily mean that just because you're that blood type you are going to get more sick. There may be other factors involved as well, and so that's something I can look into a little bit more as well. But there are definitely correlations
well,
with blood
yeah,
type
I think
and
we are.
severity.
You are right, Doc, with type O because there. I see some people putting
Okay,
type O, and I
somebody's
think
putting
they're
type O in there.
nurses. So that's what.
Good.
Yeah.
You
Oh,
got some
no fuss.
smart. Your fans are all educated
Hey,
on this.
they're the best.
They
They
are. They
really are. I
are. Your
love
fans are
them.
amazing. They really are. They're beautiful.
Amazing. Okay, and this is another question I had for you. Any misconceptions that we can reverse? Maybe like since July there were some ideas that we thought we knew about COVID. Has anything been proven kind of false? Like for
Mm.
instance, do we need to use all the wipes on groceries? Did we
Oh,
need
that's
to
good. Yeah.
anything like that that we can stop thinking or
Yeah.
doing because it's
Yeah.
really not effective?
Yeah. Okay. The one that you called out right there, wiping down groceries, that is one of the big ones. So as we understand more about viral transmission, there's basically getting the virus because somebody near you is either talking, breathing, coughing, singing, or whatever. So literally from the mouth and nose, virus particles coming out, then me being near a person that's got an infection and then kind of inhaling that virus. That is the dominant way that you get COVID-19, right? The incidence of people getting it because I touched a surface and then let's say that I'm sick, I touched a surface, then you touch that same surface and then you kind of pick your nose or you lick your mouth, you lick your finger or whatever it is. Um, that incidence is low. Now, it's not zero. So hand washing is still really, really important. This is not saying by any means like don't wash your hands. You should still very much continue to wash your hands. And you should also very much continue not trying to touch your face as much as possible. So, again, if you do have like a bunch of live virus on your hands and you rub your eye, like that's a way that you actually get sick. I know for myself, I get allergies and like I love rubbing my eyes, and it feels so good, but it's so bad for you. And I know for myself that I've gotten
Yeah.
sick before, like touching something dirty and then rubbing my eye, because you've got these mucous membranes in your eye, and that's also how the virus can get inside your body. So definitely continue to wash your hands. Definitely continue not to touch your face if at all possible. But all of those precautions around like wiping down every kind of grocery, take out the takeout boxes and wiping those down. I personally do not do those anymore. I think those are it's safe basically. I think to touch those surfaces. Now I still wash my hands, right? I still before I eat, I will wash my hands. After I eat, I still wash my hands. So hand washing is still a really, really important thing to do. But I think like the level to which, I mean, I like many people for a couple of months there, man, it was like a 30-minute process. Get back from, the grocery store. I'm taking every little thing out, washing everything. I'm letting my mail like sit outside for a while before I open it. I don't do any of those things anymore. And I think, that's been pretty well studied now as well, that surfaces are not the primary mode of transmission. The likelihood is very, very low that you're going to get sick from a surface. So that is one of the big ones, I would say.
So masks are more important than surfaces. So it's air
Yeah,
that we need to
yeah.
be careful.
I was just going to say the other big one is masks, right? We've already talked a bunch about masks a little bit, but man, it's so, TJ, that's one of the things that like makes me like the most frustrated and sad about our country in the United States. It's like in a certain level, it's just common sense, right? It's like
Yeah.
you've got a disease that spreads by virus particles that when you cough or sneeze. So it's like if I've got a mask on, like that stops the spread of the stuff from getting out in the air. Like it's kind of just, pretty obvious, right? It's why they wear masks in surgery. And, so everybody just being able to wear masks can be so effective by itself without even doing anything else, right? So let me just give you a couple of quick statistics because I was looking at a study earlier. So okay, so there's a study that the Center for Disease Control, the CDC, they just had a study looking at mask wearing in Kansas. Okay, so this is kind of amazing. In Kansas, they very recently, the governor said, hey, we want people to wear masks, but only certain, it was up to the counties to decide whether or not to enforce it, right? To say like, hey, we're going to give you a penalty if you don't wear a mask. And some were like, we want you to do it, but we're not going to do anything if you do or don't, right? And so there's some amazing statistics. The ones that had a mask mandate where there was like a penalty or a fine if you didn't wear a mask when you're inside or in certain places, they saw a decrease in COVID-19 infection of 6%. So it went down by 6%. Compared to the counties where there was no enforcement and people could just do whatever they wanted, those places saw a 100% increase. Okay, a 100% increase versus a 6% decrease. Okay, so, and this is very consistent with other data we've seen from states, including Washington, D.C., where mask wearing is enforced versus not enforced. Right, in the places where it's like you can just not wear a mask, the rates of infection are just significantly higher than places where there is some kind of a mask requirement. So, wear your mask, fam. It's
Wear a
just like
mask.
it's not, it's just not, and it's not even forever. You don't have to do this forever. It's just
Yeah.
like it's just get us through this period in particular. But it's such a small sacrifice to save lives. I mean, you are saving lives by putting that mask on. So,
Well, Dr. David, we're at an hour, so I think that's a perfect way to end. Is that we have to wear masks, everyone. Just get through this final
get through it, fam.
phase. I truly believe this is going to be it these next couple of months as the vaccinations come around. And please wear your mask.
Yes.
And let's get through this together as one. Dr.
Yes.
David, thank you so much for being here and for doing this. Maybe we may have to do one more. Hopefully not. Hopefully this will be a thing of the past. But if so, I'm excited to have you back. And again, thank you for sharing all your wisdom with my community.
TJ, I love you so much. You are such a light. You are such a light. You're to all your followers. You all are amazing. I just, you can really feel the love through your community, and that's what
we are. It's
a
family here, and
love,
that's the way it's got to be.
This is my final message. Love is the best medicine. Love is the best medicine. So all of us, we all got to care for each other. We all got to show kindness. So, make those sacrifices that right now, because if we care for each other, if we love each other, just like TJ and you all share and express, we're totally going to get through this. I have no doubt we'll get through this and we're going to make it through the other side. So love.
Preach, Dr.
Love.
I love it. Well, thank you so much, bud.
Love you, brother.
For watching. Until
Take
next
care, everyone.
time, stay safe and wear your mask.
Yes. Take care, everyone.
Bye.
Bye-bye.